And welcome back, everybody. On today's WLOX Health Corner, we're focusing on brain injury awareness. Each year, approximately 2.87 million Americans suffer from traumatic brain injuries, and strokes alone affect about 800,000 people. Joining us to discuss how to recognize symptoms, Memorial Health System neurologist Dr. Lee Voulters. Good to see you, Dr. Voulters, as always.
Good to be here.
Well, let's break them into those two categories. Traumatic, which is sometimes referred to as an external injury. Tell us a little bit about that.
Yeah, well, they can be non-penetrating, which is most common, or penetrating. So playing football, getting hit on the head, elderly people falling over in the shower. These are traumatic brain injuries. Babies, shaking babies syndrome. Anything causing a concussion, which is the commonest manifestation of the external brain trauma. Explosions. We get a lot of veterans here, people that in the military that get involved in explosions. Concussive injury. It causes the soft brain to be hit against the hard casing of the brain.
So what would some symptoms be if somebody suffers where they would then want to take action?
Right. Altered consciousness, that's what the commonest thing, altered consciousness. And that's the first question we ask, did you lose consciousness? Because the more you lose consciousness with a head injury, usually the more significant it is. And then things like losing your memory, nausea, vomiting, and then people get confused and stagger around. Their balance may be bad, and over time they may get irritable and want to sleep all the time, and just a change in personalities, all sorts of things.
Well, let's then move to the internal factors, and most people are so afraid by just hearing the word stroke. Tell us a little bit about that. Anything happening in medicine now regarding that?
Oh, lots of things are happening in medicine. So stroke is different from trauma. Trauma, there's a reason why the brain is injured from an external factor. With a stroke, the two commonest types of stroke is, one is what we call ischemic. So there's a blockage of a blood vessel in the brain, there's lack of oxygen because of that, and then the brain is damaged. And then there's a hemorrhagic stroke, so a blood vessel bursts or something happens to cause blood within the brain. Now you can get blood in the brain from a trauma as well, but for the purposes of stroke, something leaks into the brain.
Are there any indicators prior to a stroke that one might be susceptible to having a stroke?
People with high blood pressure are certainly susceptible to be having strokes. People with a family history of strokes, people with diabetes are susceptible to having strokes. People with family history of aneurysms may have an aneurysm. Those are the sorts of things that can predispose people to strokes.
All righty. Well, I wish we had more time because I know a lot of people are very interested in this subject. Dr. Lee Voulters from Memorial. Thanks for being with us, Dr. Voulters. Happy
Nice to be
Easter
here.
to you.
And to you. Thank you.
On today's